I am Audrey Williams, the Senior Manager of Community Development with the Nashville market with your American Cancer Society. I am pleased to be joined today by Dr. Cathy Ng of the Vanderbilt-Ingram Cancer Center, and she is the David H. Johnson Endowed Chair in Surgical and Medical Oncology, a Professor of Medicine, Hematology, and Oncology, the Co-Director of GI Oncology, the co-leader of Gastrointestinal Cancer Research Program, and our 2020 ResearcHERS chair here in the Nashville market. We are so pleased to have you join us today, Dr. Ng, and we've got a few questions for you. Starting with, we talked about how you're the co-leader of the Vanderbilt GI Cancer Research Program along with Dr. Daniel Beecham. Can you tell our viewers just a little bit about that work?
In conjunction with Dr. Beecham, I am a medical oncologist. He is a surgical oncologist. He actually not only is a surgeon, but also runs a lab that does that conducts cancer research. I primarily do clinical research. So the two of us together use our combined efforts to optimize cancer research amongst the GI group.
You joined the faculty at Vanderbilt-Ingram Cancer Center in July of 2019. Where were you prior to that, and what brought you to Vanderbilt?
I was at MD Anderson Cancer Center in Houston, Texas. It was my first job. I was there for 17 years, and I enjoyed my entire experience there. I was very busy there, and I really developed my career there. What brought me here to Vanderbilt-Ingram Cancer Center is the opportunity for a greater leadership position, as you can see based upon my titles here. This is a role that allows me not to just focus on colorectal cancer and anal cancer and other cancers that I'm specifically focused on, but also to mentor and develop other individuals and to take exciting work that's being conducted in the lab. Here at Vanderbilt, there are some amazing basic scientists and translational researchers, and to take that research to the clinic and to apply them to other patients and to help them with their cancer, I think that was the opportunity I thought was extremely worthwhile to make this big move. And obviously I hope there'll be other promising opportunities to come.
As you know, ResearchHERS is a campaign where powerful women are funding female cancer scientists. So what females do you admire most?
That's a tough question. There's so many. So in my field of GI research, when I was starting out, there were not a lot of women, honestly, at a lot of the initial consultant meetings and with a lot of the companies where you kind of start to network and et cetera. I would say that some of the most amazing women I've encountered was actually one with Stephanie Gregory, who's very well known in lymphoma. She's the one that actually suggested I do a fellowship in oncology. She was at Rush Presbyterian and is retired now. She was very well recognized, but she was amazing and always was still interested in my career even after I left. And then at MD Anderson, we had a wonderful woman that was very high in leadership, Margaret Kripke, who I think was an inspiration for many women at MD Anderson when it was very much a man's world at those type of leadership positions when I was there. And then I have to say, I am so fortunate here at Vanderbilt-Ingram. I'm not just saying that because I'm here, but because I've gotten to know two women leaders and have complete admiration for them as well. Jennifer Pietenpol is our Cancer Center Director and is so well respected nationally amongst other cancer centers. I've only heard positive things about her before I arrived, and all of it's been true. I would say that, and then last but not least, my former chairman, who is now the ad interim chair of medicine here, Kim Rathmel, she's become a great friend and colleague, and I look at all these women with complete admiration because I think they conduct themselves with elegance as well as inspiration to strive for more.
As you know, ResearchHERS, part of the thought process behind it is to, bring to light the fact that women have a greater challenge getting funded as cancer scientists. So what are the biggest challenges for women in research, women in medicine, and how do you personally manage some of those challenges?
I would agree that there are definitely some of those aspects. I am not a laboratory scientist, so I may not be aware of additional challenges. I would say in general there are more challenges that I've seen over the years. I think those challenges are lessening, I believe, for some of the incoming new junior faculty. So I think there's a lot more equality, I would say, versus when I was starting out my career. I would highly advise women to, number one, be persistent, persevere, and if you believe in yourself and if you really believe in your mission, then you need to get that point across. But do it with passion. Don't make sure that it's not misinterpreted as anger or in an inappropriate way. You know, hold yourself with poise and just try to remember what is the end objective. What are your goals? And if you are at the table, and if, number one, if you're in the room, make sure you have a seat at the table. And sometimes you do have to, sometimes you have to take a step back in order to choose your battles in all fairness. But if there's something worth fighting for, please take a seat at the table. Please let your voice be heard. Don't be intimidated. And I think what I've seen is a lot of colleagues kind of come and have gone in my earlier career. And some of them I have not seen them so much out in the leadership circle. And maybe due to personal choices, and that's completely fine. And then I think there are those that maybe did not feel as included, and that potentially probably they took it personally and may not have moved forward with their careers they had hoped. And I would just say that just believe in yourself. There is power in a group of women together, and there's also power in the camaraderie with your male colleagues as well. So it's really important to form a team of individuals that can support you. The best way to succeed is to succeed with a team around you to support you.
Funding the science and the next great discoveries is so important to the American Cancer Society and all of our supporters. So, in your opinion, what has been the most exciting scientific discovery to date that you've seen, or of recent memory?
For us, I would say that some of the most exciting things are the fact that we are now trying to provide more personalized care to patients with testing on their tumor tissue as well as on their even through their utilizing a blood specimen to look at various mutations that the patient's cancer may be expressing, that in fact we have drugs that potentially target those mutations now. So I would say that is one of the most exciting things currently, as well as there is obviously some benefit for immunotherapy in certain situations, not all cancers, but some cancers. And as I mentioned earlier, I'm obviously quite excited about immunotherapy and its potential in virally induced malignancies. So I would say that those are some of the most exciting things currently in GI cancers, is the fact we really are trying to provide more personalized care so we can, number one, focus on the cancer and obviously try to cause less harm to the patient overall. And we hope that in the long run, we're obviously improving their overall survival by utilizing not just standard chemotherapy, but also more focused, personalized treatment.
Dr. Ng, you are a passionate and inspiring woman. We are so grateful that you took some time to talk with us and answer some questions today, and we thank you for being the chair of our ResearchHERS campaign. We would just really appreciate everything you do in the fight against cancer.
Thank you so much. It is my absolute honor to serve in this role, and thank you to the American Cancer Society for being so welcoming to me upon my arrival here in Nashville. So I really appreciate it.